Hi everyone, my name is Yenisbel Hernandez and I'm here with ABA Exam Academy. Today we're going to cover a task list G, and specifically we're going to be, I want to sort of combine the G02 and G05, and it's G05 is about describe and explain behavior, including private events in behavior analytic, non-mentalistic way. So I want to focus on the part of non-mentalistic versus behavior analytic. I want to focus on differentiating mentalistic terms and behavior analytic terms. And I want to combine that also with G02, which is about considering biological medical variables that are affecting our clients. What are we going to do? Basically, we're going to talk about it and we're going to answer more questions, and that's the best way to learn, because you tackle two things or more than two things. You learn the material and you also practice test-taking skills, because we need it. This is where we need to pass the test. So we're going to learn. My focus today is for you to focus on keywords in the scenarios, in the questions, in the sentences, because that's very important, especially if you want to differentiate those two terms. Okay, so really quick, our disclaimer here is that ABA Exam Academy, we're basically here just to help you ace the ABA, BCBA, BCABA exam. And our meetings are meant to have an active discussion, collaboration, ask questions, and provide helpful suggestions to better understand the BACB 4th edition task list concepts. And that's why it is important that all viewers and participants are responsible to verify the accuracy of the information being provided in order to successfully prepare for the BCBA exam. Basically, sometimes we make mistakes in the rush of the time and in the rush of the moment. So verify everything that we say. And I am Yenisbel Hernandez, and I'm a BCABA, and my PowerPoint and mock questions were all created by me. So just remember that our ethical considerations is do not share any specific BCBA exam questions during the meeting, or any mock questions from any paid resources or any identifiable client information. And we do encourage sharing open resources information, but just make sure we give credit to those who created it. And with that in mind, let's just say that I use Cooper, Mayer, and Pass the BCaBA exam manual as references. And let's get started. So Robert has a cold and fever. Robert has cold and fever. When he has a cold and fever, he cries. The cold and the fever are the causes of Robert's crying behavior. Is there mentalistic information in this scenario? Yes or no?
Yes.
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 Yes, perfect. So let's move on. Good job, guys. So the same scenario. From the above scenario, the following is a mentalistic sentence. So let me read it, and then you tell me. Robert has fever. When he has fever, he cries. The fever is the cause of Robert's crying behavior. Robert is crying because he has fever. Or a combination of A and B, or a combination of C and D. I put more combinations so we can, because this one is more for the sake of us learning the concept, differentiating between the two. Mentalistic and behavior analytic terminology.
F.
So somebody said F. Who said it? I didn't catch your name.
It's Damie.
Oh, Damie, I didn't recognize your voice.
And I said F too.
F. Okay. Anybody else?
Me, Gazelle. I'm going to guess C.
C as in cat?
Yes.
Okay. Thank you, Gazelle. Somebody else?
C.
C as in cat. And F. Okay. So let's see. So the answer was partly Gazelle, and the other person that said C were partly correct. We were just forgetting the fact that the other one also is mentalistic. So those of you who guessed F, can you explain for the rest of us why is it C but also D? What is the key word that is telling you it's mentalistic?
For me, it was their circular ways of talking. Like the fever is causing him to cry. He's crying because he has a fever. So it's like a circle. It's not necessarily explained the way. It's just kind of, you know, one doesn't cause the other, but how they're explaining it, it is.
Perfect. I love your explanation. I love the word that you use, circular reasoning, right? That's part of mentalistic. And also, if let's say that we have no idea what you were talking about, let's just remember that the words because and causes, those are always they're gonna be mentalistic because we have not proven it. We have not proven it. You see what I'm saying? We need to prove it with our ABA methodology, our ways to do an FA.
Got it. Thank
Sorry,
you.
the FA wouldn't pop up. Okay, so I got this one from Mayer. And Mayer says, if biological and physiological variables are not causes of behavior, then why is assessing them important? A, those conditions can serve as antecedent influences of behavior. B, those conditions can be controlling the behavior. C, those conditions can serve as the consequence of the behavior. And none of the above or all of the above. But I don't want to confuse you with these two. Let's just focus our energy on those three.
I would say B.
Okay, thank you. Lily, right?
Yes.
Okay, who else?
I also go with B.
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 Okay, let's see what the book says. The book says A. Those conditions can serve as antecedent influences of behavior. So this is why I wrote it, because when I was reading it and studying it, it was confusing because this is slide 11, right? Let's go back to this slide. You see, in G02, we need to consider medical variables, but it doesn't say we need to consider medical variables that are the causes of the client's problem behavior. What are the keywords that they're saying?
Affecting.
That may
be affecting.
May be affecting. Yes, you're affecting, but they're before affecting, they're adding sort of like a disclaimer, like, well, we're not sure. That's the way we always have to say it as BCBAs. Let's go back to 11. Does that make sense, guys?
Yes.
Yes, and I was gonna
Okay.
guess A, but everybody already started saying B, so I got nervous and I didn't say it.
But it's okay. That's what happens, and that's why I like the way we do this, because we tend to get nervous, and that sort of mimics the way we get nervous in a test, right? Because in a test we also get nervous. So little by little, we need to get used to answering on the spot, even if we get it wrong, because that's gonna desensitize us. Although we're under anxiety and a little bit of stress and we're like confused, we still are able to come up with an answer fast and faster and faster until we get them right. Okay, so the key thing that I want you to focus on here is we do need to consider biological and physical variables. Basically, we need to consider the client has a headache. We need to consider the client has allergies, that the client has pain in the stomach. But do we say that those things causes the behavior?
No.
No. So those things serve as antecedent influences of the behavior. We're gonna go more in depth now, just to simplify it and make it easier. So I put simple sentences and very repeated it. I sort of repeated it around. So we can differentiate the keywords that makes it mentalistic and behavior analytic terms, okay? And let's try to do it fast because I think you got this. So he's crying because he has fever. What is that?
Mentalistic.
Mentalistic. I agree. So let's just put there,
Because.
yeah, let's put the word because. Okay, so he's crying. Should say he's crying. No, I'm sorry. His crying may be related to the fever.
Behavior analytic.
Behavior analytic,
Okay,
because
what's
it's maybe.
Keyword maybe.
Nice, guys, we're getting it. The fever may be related to the crying.
Behavior analytic.
Behavior analytic.
I read it wrong, but it's the same. The fever may relate to the cry. May. So as a result of the fever, he's crying.
Mentalistic.
Mentalistic.
What is the keywords?
As a result.
As a result. Okay. The allergies cause the problem behavior.
Mentalistic.
Mentalistic.
What?
Caused.
Good. The allergies may interfere with adaptive behaviors.
Analytical.
Analytic.
Behavior analytic.
So what's the keywords?
May.
May interfere, right? And Melissa passed the BCBA test because she studied the task list.
Because mentalistic.
Mhm.
And the word is because.
Because. And how can we change that one to behavior analytic terms? It's tricky to change it. That's why I want us to get used to it.
If you go, the allergies cause the problem behavior. So in this one, the cause.
I mean, the Melissa passed the BCBA test because she studied the task list. So you want to give it a try and tell me how you would change it into, instead of mentalistic, to behavior analytic term, using behavior analytic terms.
Melissa studied the test that may have influenced her pass the test.
Awesome. I love it.
Yeah.
Yes. Look, I put the same thing. Nice. We're in the same thought. So I study Mayer closely, and what I did is as they were talking about these things in general, using research and stuff like that, I'd highlighted the keywords. So these are the keywords that I found throughout. And not just for the test, but beyond, when we write our program, our behavior intervention programs, these might help us. I think those are really good. So I wrote the same thing here, but with Skinner, you know, he's going to be very sad if we do mentalistic terms, and he'll be happy if we do behavior analytic things. Terminology. It's key. Okay, let's do a more complex one. Ready? Jenny has worked with her client, Juan, for a year. His maladaptive behaviors so far have been elopement and task refusal. Juan started a new medication on Saturday. When Jenny comes back to work on Monday, Juan engages in elopement 5 times in an hour session, 3 minutes each. In SIB, 3 times for 5 minutes each time during an hour session, and in task refusal 1 time per 1 hour session, and lasted 6 minutes. What is the best thing Jenny should do? Okay. A, conduct an FBA as soon as possible because SIB is a dangerous behavior for the client. B, continue with her current treatment plan for the other behaviors because that's what she has written in the program. C, tell Juan's mom about the SIB incident and Lara needs to report it to her supervisor. Or D, demonstrate that recommend that Juan's parent contact his doctor.
A.
So I have one for A.
D.
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 One for D and one for B.
D for dog.
D for dog,
D for dog.
D for dog.
Yeah, D, dog.
Okay. Let's see. Okay, so why D for dog, guys? Explain it to us.
Because you've been working with him for a year and his maladaptive behaviors so far have been elopement and task refusal, and he had started new medication and new behaviors occurred after starting that new medication.
Yes. So when in doubt, refer to a doctor. That's the best bet, I think. And this also comes into ethical issues and stuff like that. A sounds good, right? On 2, we read the part about the ethics and this part that we have to refer to the doctor. So what the book says is you should recommend seeking a medical consultation if there's any reasonable possibility that a referred behavior is a result of a medication, side effect, or some biological cause. Okay, so just focusing on test-taking skills. Should you have focused on this, the 5 times, 3 times, 3 minutes, all of that?
No.
No, that has nothing to do with it, right? So when you're in a test, you have to refocus your attention to what part of the scenario, the bottom part or the top part?
The top part where it says medication.
Yes. So basically what I just did here, focus your attention on the question and then on the part that is talking about what the question is asking. Good job, guys. Nice catch. Okay. This one's long, so bear with me. Jennifer was contacted by a parent of a child with autism. The parent reports that her son is a picky eater. He screams, cries, rubs his belly, and runs away from the table when the parent presents the dinner. Dinner is typically homemade food, meat, rice, and beans. The parent states, he is very stubborn. He would eat his dinner with no problem last month. Now he just decided to stop eating dinner and wants to run around. Also, the child eats breakfast with no maladaptive behavior. Breakfast is typically strawberries, almond milk, shake, and homemade bread. So Jennifer should, and here are my options, begin an FBA to determine the function of the child's maladaptive behavior in the morning. Recommend the parent to seek a medical consultation to rule out medical causes for the problem behavior. There's no need to recommend medical consultation because the child was eating the same type of meal a month ago and he had no maladaptive behavior. Or D, there is no need to recommend medical consultation because the child eats breakfast with no maladaptive behaviors. I added the last one, but let's delete this one so we don't get confused.
B.
Okay, we have one for B.
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 Go with B.
So I have 3 for B, and that's good. So who wants to explain why is it B? Why didn't you pick C or D?
I picked B because usually when you want to start something like as far as potty training or food, even though they might eat something, doesn't mean that they might have like some type of, you know, like swallowing or problems with chewing or something like that. So you might want to do the medical seeking before you implement those. So that's why I went with B, but maybe there's a different explanation.
No, that's perfect explanation. Go ahead. Somebody was going to say something else?
Yeah, I was just thinking because he was eating it a month ago, and now he's screaming, crying, rubbing his belly, and he's running away from the table when the parent presents the dinner. Those are typically maybe something that could be medically wrong.
Yes. And sometimes some parents might say, oh, it's just behavior, like this parent here. But sometimes the kid accepts the food and then all of a sudden they just have become allergic. Like my son, we did an allergy test and he used to eat meat. And then a year or so, 2 years later, we did another allergy test and he was allergic to meat. So that's why this is tricky. So like we said, just continue to select those medical, just recommend to the doctor. Okay, so just to relax us a little bit, I did this one a while back and everybody found it hilarious. I don't know if you guys are gonna find it hilarious as well, but let's change this around. So the cow has an illness called crazy flying cow, and that is why she went up a power line pole. How can we change the above sentence into behavior analytic terms?
Well, you can take off the word because.
Yep. Let me give you some tips. You can say the cow's illness called crazy flying cow may have influenced the cow's behavior of going up the power line. So just remember, my focus is for you to start remembering that we never say because. If we see it in a question, we see it in a scenario, then keep an eye on it and be careful. Let's do the last mock. Let me see, is this one tricky? Okay, this one's the tricky one. This one tricked me the other day, and I'm the one who created it. So let's see how you guys do. Demi has a client, Danny, who has been banging his head against the wall every day for the past 3 days during therapy. Demi reports this new maladaptive behavior to his mother. His mother takes Danny to the doctor. The doctor determined that Danny is experiencing migraines. After the doctor's appointment, Demi reports to her supervisor that Danny's banging head against the wall behavior was caused by his migraine. According to the above scenario, which was an example of Demi behaving ethically? Demi was behaving ethically by recommending Danny to be taken to the doctor. That was A. And B, Demi was behaving ethically by reporting to her supervisor that migraines are the cause of the new maladaptive behavior. And I put none of the above or all of the above, but I just want you to focus on the actual answers. So just focus on those two and tell me.
A.
Oh, shoot. I'm sorry. I'm the one who confused you by not confusing you. By trying not to confuse you. That has to be there. And I think by doing that, I confused you. Let me start again. So I agree with you. A could be, but the answer is, the question is, and this one I did it for purpose of us getting used to reading what the scenario says and reading what the question says and not adding or taking away anything from it, okay? So what is the question? According to the above scenario, which was an example of Demi behaving ethically? So according to A says that Demi was behaving ethically by recommending Danny to be taken to the doctor. Did Demi recommend Danny to be taken to the doctor?
No.
No.
No. So that was my thing there for you to catch.
Well, I thought it was better than B.
Yeah, but that's why I confused you. I'm sorry, by deleting the none of
Okay.
the above. I shouldn't, because I was deleting in the other questions and I thought this was not needed. Well, but that was my trick of the night, guys. Thank you so much for attending. I appreciate it, and I
Thank you.
love to pick your brains.
Thank you.
Go relax and enjoy your night.
Great question, Danny.
You're welcome. Bye. Have a great night, guys.
Thank
Bye.
you.